Good morning, everyone. I'm Jill Chadwick, in for Dr. Steve Stites, Chief Medical Officer, and we are coming to you from the Dolph C. Simons Jr. Family Broadcast Studio. With us in studio today is Juliann Van Liew. She is the director, new director, 3 months on the job, I believe, or 3 weeks rather.
3 months.
Director of the Unified Government of Wyandotte County and KCK Public Health, and Dr. Dana Hawkinson, of course, Medical Director of Infection Prevention and Control. In Studio B is Patrick Sallee, Chief Executive Officer of Vibrant Health. And we welcome them all. We've lots to talk about the impact of COVID-19 on the Dotte, including death disparities, which we are going to show you, visualize in just a few moments. But first, Dr. Hawkinson, how are our numbers today?
They're good today. You know, we said, and Dr. Lisman said there's a new normal. We've always talked about our new normal. There will be day-to-day fluctuations. Today we have 21 in the hospital. 8 of those in the ICU and 2 on the ventilator. So that's better. I think we were up to 26 or almost 28 yesterday at some point during the day. So that's very good. We want the numbers as low as possible. We want as few hospitalizations as possible. We still have 23 that meet the recovery period. So there are still about 45 patients in the hospital that wouldn't normally be here because of COVID. Out in Hays, there are 17 total in the hospital. There are 15 that are active acute COVID infections, and there are 2 that are in that recovery phase. So.
And the recovery phase, again, is still not contagious, but...
Yeah, it tends to be based on the CDC guidelines when we can discontinue the isolation precautions because they are figured to be non-contagious or not infectious. And that's typically about 10 days after their symptoms or 10 days after their hospitalization.
All right. Yep. Thank you for that update. Juliann, tell us who you are, a little bit about you, because you're new to the position, not so new to the community, but let's introduce you.
Good morning. As she said, my name's Juliann Van Liew. I'm the director of the Unified Government Public Health Department. We're the health department that covers all of Wyandotte County, including KCK. I've been the director for just 3 or 4 months now, but with the health department coming on 3 years. So very excited to take over in such a crazy time. We've certainly had our work cut out for us, but today I'm excited, not super excited, but I'm happy to be here talking about the mortality indicators for Wyandotte County, and especially what is coming out of that in terms of health inequity in our community.
As you said to me right before we started this broadcast, I said, I was sort of unnerved by the numbers, and you said, yep, on every metric, we are not trending in the right way. Talk to us about that now. Walk us through.
Absolutely. Is my slide up for the public?
The slide is up for the public. There you go.
So you can see here some kind of high-level mortality indicators. The first row of numbers there are just the flat number of deaths that have occurred within those jurisdictions that you can see. So for Wyandotte County, as of yesterday, we had 134 deaths. And those numbers are important, but what's even more important is that second row there showing the crude death rate per 100,000 population. This really makes us able to compare ourselves to one another in terms of across county and across state lines. So you can see here that our death rate due to COVID is actually 5 times higher than Eastern Jackson County, 4 times higher than Casey-Mo, and around there for Johnson County as well. So what this is showing is that folks in Wyandotte County are dying at much higher rates for COVID than in our surrounding communities, unfortunately. You can also see here that deaths associated with an outbreak make up just short of half of our deaths, and deaths associated with long-term care facilities are just near 40%. I point that one out in particular because often people think that that's really the only place where we're seeing deaths, but more than 60% of deaths in our community are not associated with those facilities. Lastly, important to note that just shy of 80% of folks have been hospitalized who then end up into mortality. So there are folks who don't end up in hospital. Just quickly to show you kind of a distribution geographically for Wyandotte County, you can see where the deaths are spread out. That middle zip code there included our long-term care facility with the most deaths. They had around 40 deaths, so that's why that's that biggest hotspot there. But you can really see that deaths are throughout the county. By age group here, this is pretty typical of what you'll see across the country in most jurisdictions, obviously higher numbers of deaths in the 60 to 100 population. Next slide, please. This gives a little bit further information so that you can see the trend over time. So obviously you can see in April we had our greatest number of deaths across the county, impacting a whole number of age groups. You can see as we shift to the right and get closer to July and August, there are a little bit more of those younger deaths showing up. We believe our older populations are taking greater precautions, and we've also done a tremendous amount of work intervening in long-term care to really reduce those deaths.
And that blue line is, go back one sec, yeah, that blue line represents what age group, 20 to?
The light blue?
Yeah.
That's the 60 to 69.
Oh, 60
so that's
to
our group
69.
that's kind of typically been real steady across, but that little bit of orange and then the gray and the yellow that you can see show that our younger populations are creeping up a little bit more as well.
And that's heartbreaking. I mean, it's all heartbreaking.
Right, but the younger is certainly, and it's different than what we're seeing in some communities. Just want to point out a little bit of disparity data. So the graph on the left-hand side, again, is just the flat numbers. So among our white population in Wyandotte County, we've had 60, 62 deaths, and our black population around 50. And again, those numbers are important, but even more important are the race-specific death rates. So per 100,000, in each of these categories within our community, we're actually seeing much, much higher rates of American Indian and Alaskan Native and Native Hawaiian and other Pacific Islander. Those are very small populations in our community, so even a handful of deaths mean that those rates end up very high. The other interesting thing here is that you can see is that the black rate is significantly higher than the white rate, despite white deaths being a higher number than black deaths. Again, that's due to the proportion of black to white in our community. And then similarly, by ethnicity, you can see we've had a much lower number of Hispanic deaths versus non-Hispanic. We would assume we would see that since Hispanics make up about a quarter of our population in Wyandotte. And when we look at rates, again, the non-Hispanic rate is higher, but the Hispanic rate is really starting to creep up lately here in the last couple of months due to the massive explosion of Hispanic cases that we've seen across the county. So really quickly, just to sum up why we're seeing these disparities in Wyandotte County compared to other jurisdictions, as well as those disparities within our community, we have much poorer, unfortunately, baseline health outcomes in Wyandotte County. We have higher rates of the vast majority of typical cancers, higher rates of hypertension and diabetes, and all across kind of those comorbidities that we're always talking about as being risk factors. We have higher rates of those in Wyandotte. And not just across the board, but especially higher rates in our Black and our Hispanic communities. And so those are really just being exacerbated right now. Other important drivers are economics and industry. So primary industries we have are packaging, manufacturing, transportation. Healthcare is actually our leading sector in Wyandotte County, driving our economy. All of those are sectors in which folks can't stay home. They must go to work in order to work. They're often close contact jobs, and that really plays out in how we're seeing our COVID cases. And then lastly, we know our community experiences significant barriers to care. So we undertook a large survey last year, and the major barriers to care we have in Wyandotte are language. We have a lot of folks who are non-English speaking, transportation, and cost. And so when you factor those in, that means that people end up getting care later than they otherwise should have, and that certainly plays into that mortality rate as well.
You really outlined that very, very well. We want to come back to you and ask some questions. I know that one place a lot of these people can go for help is Vibrant Health. Patrick, we checked in with you a few times during the pandemic. What has improved? What has stayed the same? Or what's getting worse?
Well, thanks, Jill, for having me again. I appreciate you all highlighting what Vibrant Health is doing, but really more importantly, highlighting the need for equitable access to care and treatment and testing, particularly in Wyandotte County. So things continue to progress with our testing. We are doing tests 4 or 5 days a week across the community. Recently, the health department changed testing criteria to include asymptomatic testing, which I think is a great step towards getting more and more people tested. Overall, things are positive at Vibrant Health. We saw a busy month in August with back-to-school physicals. We are starting to see calls from patients whose children are in school and have had an exposure or have symptoms, and so there's sort of a little bit of a spike in concern or testing for kids that are back in school. So that's a little bit concerning as to where we're headed in the next few weeks. I'm sure Dr. Hawkinson has way more insights than I do on what's driving that and what's coming next. But we're starting to see that trend a little bit in our clinics.
Do you want to speak to that? Are we seeing anything yet, or is it too soon?
You know, I think in general, in the Kansas City area, certainly our numbers, pure cases per day, is definitely higher than it was a week or 2 weeks ago. We've kind of crossed that threshold now of 300 or more cases a day. We were down to 260 cases a day. Again, that's for the Kansas City community as a whole.
So we know that whatever affects the Dotte affects the rest of us, especially when it comes to the pandemic, because we are mobile and we travel. And as we've heard Dr. Hawkinson and Dr. Stites tell us many times, this virus is looking for a host. So I want to ask both of you before we go to media questions and community questions, what is it that we can do to help? I'll start with you, Juliann.
We can do the things we all know that we already need to do, right? It's the mask wearing, it's the social distancing. Right now, we certainly are very concerned about the school situation. By and large, we've had very good, partnership with schools and school nurses. We currently have about 7 classrooms on quarantine in Wyandotte County right now. So the main things we're asking of our community is that if your kiddo has any symptom, please keep them home so that we can keep the rest of the kiddos in the classroom and safe.
Patrick, what would you add to that? What can we do to help the Dotte?
Well, I think Juliann hit it on the head. I would say, add anecdotally, we've had a number of staff members at our clinics that have had to be tested, and a number that have been positive. But one of the things we know from tracking where their exposure came is it didn't come it didn't happen at work. The exposure to COVID and where they got it was outside work in their own personal lives. And you might imagine in our clinics, we're pretty strict about distancing and masking, washing hands, and all of those behaviors we're asking everyone to do. Now, people are human, are going to behave in different ways outside. But I think the point of that is if we're not seeing a bunch of exposure and exchange of the virus in a workplace where there's strict use of that, the same would hold in public. If we go out into stores and we're wearing masks and keeping our distance, we can drive this down.
How's it impacting business? Do you have any feel for that? I know that you support them. Do you know, Patrick?
Meaning the business community?
Yeah. How's the virus impacting the business community? Are people mask wearing and doing a good job, or?
I think we've seen a trend upwards in that, where there's a lot more businesses holding staff accountable to this. There's been a couple of instances where you've had hotspots, but at least in KCK, the KCK Chamber, partnering with a number of other community organizations, has done some training recently for businesses on how to manage people with exposure to get tested and coming back, and how to manage personnel and staff in your office, what policies to put in place. And that's important messaging for us to get out.
And I also know that right before Labor Day holiday, I think there was an initiative that was announced that's something like Keep Wyco Well. And we're going to have some of those folks on next week, and they're going to talk about that pledge and update us on that, too. So thank you. Bob Hallinan is with us in studio to share your questions. But first, let's check with the media. Do we have any reporters on the line that have a question for our guests? I would say we don't, but Bob, I think you got some text today.
Well, we do, and I do have a media question. Before we get to that one, I want to get to one from a viewer just came in. It's a little more on our topic here. What are some of the next steps Wyandotte County is thinking about? Help is definitely needed. This comes from Cindy.
Absolutely, help is needed. Patrick mentioned our shift to asymptomatic testing. So our testing numbers have been down in Wyandotte County. It's obviously very difficult to identify cases if people aren't coming for testing. And so that's our biggest shift. Our pop-up testing sites with Patrick and our other FQHCs are doing that asymptomatic testing. And now at the health department, you can get that 5 days a week as well. So that's a big one for us. We're also very shortly going to be pushing out saliva-based testing. We've recently done a validation study, and we'll be shifting to providing testing in person at all schools within our county, as well as within our jail and our behavioral health center. So we're trying to just really push the testing and use a methodology that is a little less invasive.
All right. Sandy is a freelance writer, and she has a question about UV lighting machines. She says, what's the science behind UV lighting to fight COVID, and do these machines really work? And if they do kill COVID-19, why aren't they being deployed in schools and businesses in a large scale?
Yeah. So there's a couple levels to that question. So we do know that UV light is pretty destructive. We've seen that in our human bodies because we know UV light, sun exposure, can cause skin cancer. So it's destructive to the bonds that are in the genome, whether it's our genome, our DNA, or whether it's the viral or bacterial genome, whether it's DNA or RNA, we know that UV light can be destructive. Unfortunately, for some of these pathogens, such as for SARS-CoV-2, really the use of UV light, we do have a UV light robot here that we've deployed for various reasons in the hospital, but it does take a lot of time. It's not just a single flash of the UV light. It's a longer time. And what we also have learned what we've come to learn is that really the objects on the surfaces, the fomites, the inanimate objects, the virus, when it's there, is really not the main source of spread. So while there has been a big push to have, overall super cleaning done, or one place will stop business for one day just to re-clean, we've really seen that isn't the main cause of spread. And what really is the main cause of spread is people congregating together in groups, close together without masks, not adhering to those simple things of distancing and mask wearing. So UV light, it can be an adjunct, but not using it really doesn't cause a lot of harm either, or more infections per se. Even we know that just simple household cleaning products for the most part are enough to destroy the virus. So it can be a good adjunct, but it, again, is certainly not a silver bullet. It is expensive, and it does take time for the UV light to interact with the virus as well. It's not just a simple, quick method.
And if that could work, you would think the sun would have killed it off this summer.
Yep.
Right? Do you guys use UV light anywhere with the health department?
Not in the health department. We are in other areas in the unified government. Our public works and our fire and PD are using that to some extent.
Yeah.
Patrick?
We don't. We don't, not right now.
Okay.
Lori says, I have type 2 diabetes and have read I'm at high risk for the worst outcomes with COVID-19 because of inflammation and raising blood sugars. Can you expound on this?
Yeah. Well, in general, we know that people with diabetes, especially if their blood sugars are not controlled, if their A1C, their hemoglobin A1C is high, and for you diabetics, you probably know what that is. In general, diabetes can be an inflammatory state. So you have these micro areas of inflammation going on in your body already. This just leads to your body not functioning as optimally as possible, and this includes your immune system as well. That is just one of the components of all of this. So it is diabetes, but it is other comorbidities as well. And that doesn't mean just because you have diabetes that you are going to have the adverse outcomes. It just means you are more at risk. And certainly if your diabetes mellitus is not controlled optimally, you will have higher risk of those outcomes as well.
I know obesity is also considered a factor in, we're going to have guests on next week about that too, experts, talking about what does the CDC call obese when it comes to COVID that puts you at risk. Yeah. All right, Bob, next question.
Meredith says, my daughter goes to school in a rural community where the teacher allows them to take off their mask while seated, saying they are properly distanced. Is this safe?
Yeah.
This is certainly not safe. We are encouraging, in Wyandotte County we have a mask ordinance, so masks are on at all times in all schools who are in person. Even when there's distance in a classroom, we just know more and more about the aerosolization of COVID-19 and about the ability to contract it when you're in an enclosed space with other individuals. So I would ask that person to please contact their school administrators and their school boards to ensure that those masks are on at all times.
Patrick, what do you tell your patients?
We tell them the same thing Juliann just described. Especially the longer period of time when you're sitting in class for a full day, we definitely encourage people to have masks on for that.
All right.
Quetta says, my husband and I are both recovering from COVID-19. How long do we have to wait to offer our plasma? We're still experiencing some lingering effects.
Oh, that's a good question.
Yeah. Well, in general, for plasma donations, they want somebody who's probably been about 3 to 4 weeks in or out from the initial infection or symptom onset. If you were well and you didn't have to go to the hospital, there's a concern that maybe you don't have high enough antibody titers, because we have seen that people who have more severe disease maybe have higher amounts of antibody. The best thing to do, though, is contact either Red Cross. I believe they're accepting donations, but we use Community Blood Center. So contact the Community Blood Center and talk with them and get their full details about donating plasma. Certainly, more is needed. We are going to be using plasma here now at the health system. We were initially using it as a trial. We were in collaboration with the Mayo Clinic using it as a trial. It is an EUA, emergency use authorization, by the government now, so we are back to using it. We still don't know the full benefits of using it. In addition, we don't know the timing of using it in the onset of illness. It probably looks like it's going to be more helpful using it early in illness or early after infection or when symptoms occur, rather than later, say 7 or 10 days after that.
All right. Arietta asks, my child is in high school and they're planning to have a basketball season. My husband and I are both high risk. Is it safe for my child to play?
We in the health department would say no. So we have prohibited contact sports that are affiliated with schools within our jurisdiction. Obviously, we can't control them going to other jurisdictions and playing. But we know that without masks, that close body contact, the breathing on one another, the yelling and screaming that happens in the stands puts not just the players at risk, but everybody in that building. So we would strongly advise against that.
Yeah, certainly. This goes back to the simple concepts. Outdoors is better than indoors. Distance is better than proximity. Masking is always much better than than not masking, as we heard about in that first question as well. So,
All right.
All right. Melissa is asking, does the University of Kansas Health System provide asymptomatic testing, and will they provide that in Hays?
Yeah, well, we certainly have that. If you have, it is the recommendation of the CDC now to test asymptomatic people. We do have that for our physicians who are able to order what is the reason you're ordering asymptomatic, especially if you're a contact. If you're not a known contact to somebody who has it, it's probably not worthwhile, again, because the test that we do is really only good for that day or maybe one day later. But we do offer it, again, especially if you're a contact. Unfortunately, the CDC hasn't really given any good guidance on when exactly to test if you're a known contact. Is it 2 days later, 3 days later, 5 days later? We want to really say probably about that 5 to 7 day after your exposure, you may have the highest chance of having a positive if you truly are infected. So we are still working on that, but certainly we do offer that, especially if you're a contact of a known case of COVID. And I'd like to hear what, you touched on it initially, and Vibrant as well.
Yes, absolutely. So we have shifted to asymptomatic. We've been testing contacts, asymptomatic contacts to cases all along. We are using a 5 to 9 day window. There's been some recent literature that's come out that shows days 8 and 9 are also great days to test post-exposure. So we would encourage folks to not come, the day after an exposure, even 2 or 3 days, because there's just such a probability that we may miss it. So please wait till at least that day 5.
Yep.
Is there a cost, and where do they go?
So there is not a cost for to be tested at either the pop-up tests associated with Vibrant or at the health department. You can come to 619 Ann Avenue in KCK to be tested Monday through Friday, 9 a.m. to 3 p.m.
Patrick, when you have people that come to Vibrant for Health, do you screen them with questions and conversationally and try to encourage them to test?
We screen everybody that comes in for an appointment, much like the health system does. If someone, our providers also ask about exposure, and so we would, in clinic, we would only do, right now we're only doing asymptomatic testing if there's an exposure, and following the health department guidelines on number of days since the exposure. But we're having multiple conversations throughout the process with patients about symptoms and potential exposure that they may have had, and screening temperature at the door.
Are you testing very many children?
We haven't been, but that has increased a little bit as school's gotten back in session.
And you? Juliann, have you had very many children?
Same answer. We don't test a huge volume of children, but in the last 2 weeks, it's significantly increased.
All right.
Adrienne says, I'd like to know about the amount of obesity and DM in Wyandotte County. Could this be higher in areas with higher death rates?
Yeah.
Absolutely it is, yes. That again goes back to the morbidities that I mentioned in my presentation, that we have very high rates of diabetes, of hypertension, and of obesity in Wyandotte County, and those are certainly in the same areas where we're seeing the high death rates, which is largely central, eastern Wyandotte, northeastern Wyandotte in particular, where there are high rates of death.
I assume, Patrick, since you're taking care of the same population, your answer is similar?
Yes, that's definitely
Consistent.
true, and tied to some of the economic and racial issues we've talked about before in this on this issue.
And I just remembered, I don't know if we spoke to, is Hays going to have asymptomatic testing?
I don't recall what they're testing.
Okay, so we'll check on that, yeah.
All right, Marissa says, I'm getting married outdoors on a farm with masks and hand sanitizer. There will be 100 guests. What else should we do to stay safe?
That makes me incredibly nervous. I will be very forthright with you. And it makes me nervous because we had dozens of cases associated with a wedding 2 months ago. We had a dozen cases associated with a funeral just 10 or 14 days ago. So these are very typical outbreaks that we see. And it's exacerbated by the fact that weddings often involve people coming from around the country, or at least from around the metro. So once you have an exposure, then those people go home and they're spreading that anywhere that they live and work, right? So those sorts of events makes us very nervous. The particular parts of those events is that make me nervous often is the food and drinking aspect. So people are gathered around a table and they take their mask off. And once people take their mask off to eat and drink, it rarely goes back on. And so for me, if I was planning a wedding and had to do it right now, outside is obviously better. I would try to figure out a way to stagger eating and drinking. So folks who are eating can be in a particular area of tables, mask back up to come back to the rest of the population. We know that those things aren't super exciting to people and are difficult, but it can make a huge difference. And I don't want to be calling you 2 days after the wedding to ask for your entire wedding roster and call everyone who attended, right? We'll certainly do that. That's part of our job. But for me, it's the eating and drinking. And especially once alcohol comes into play, people just tend to stop adhering to those appropriate behaviors. So if I was you, I would also have a couple of people at my wedding whose only job was to encourage mask wearing and social distance and to pay attention to the people around them.
My daughter actually went to a wedding, to my chagrin. It was outside. It was in a park. She was just her and her husband, just a handful that were masked. They socially distanced. She sent a picture. She said, I'm out whenever did come time for the food. She said it was self-serve. It was kind of like a buffet. Yeah. Can you speak a little bit more to the food situation? Even here in the health system, you can't touch anything anymore. You have to have someone handing it to you. Does that help? Does it make a difference?
It does make a difference. We know, especially with buffets, there's just so much gathering and huddling. So for me, it's just that people don't adhere to that 6 foot when they're waiting in line often for things, and especially food. So it's really the fact that people cluster around it. Those lines don't move especially fast, so there's often delay. Plated food is always better. Packaged food is always better than just having food out on a table.
Yeah, absolutely. And if you can, cut it down to about 10% of that, The smaller group gatherings are certainly better. We know you know that obviously from the question, but 100 people is a lot of people. You could almost estimate that there are maybe going to be at least 4 or 5 people who have the infection at that point in time, and then it's easy to spread from there.
Why do we always think that our friends and family, even if it's extended, that it's okay? What is happening there? Because we do, right? We feel safe.
Familiarity makes us feel safe. It certainly does. It's hard, and we think about COVID as being an external threat, right? And when we're with our loved ones, we don't feel any sense of threat from them because of our relationships with them. So it really is just a comfort and safety factor, and makes us let our guards down.
I think we have time for maybe 1 or 2 more questions, and then we're going to wrap this up.
All right, Betsy wants to know, what's your recommendation for transitioning to seeing and spending time with family that you haven't seen for the past 6 months?
Do you want to?
Yeah, I can.
You want to
certainly,
go first?
It goes back to these concepts. Outdoors is better than indoors. You can still distance. You can still talk and see them at 8 to 10 feet away. Masking is definitely a must. Certainly I don't find a problem with at the beginning or at the end if you're giving them a hug, their loved ones, their family, you want a hug. With the mask, having that interaction for 1 to 2 seconds is really not going to be a significant amount, especially if you're both masked. So those are the things that you can do. If you can't do it outdoors, and if you have to do it indoors, again, look for that spacing. I think it can be done safely, and that also, wearing the mask in the household, because are you sure who is in their bubble? That is the biggest issue. They may be safe, but you don't know who's in their bubble. You may be safe because you know who's in your bubble, especially if you haven't seen them for 6 months.
Yeah, I think he absolutely nailed it. The other thing I would say is, it does make a difference whether or not your kid is in the classroom right now. So if you have a kiddo who's going to school with a large cohort of kids, that would be something that would make me a little bit more cautious if you're going to see grandma or whatever the situation is.
One more question, Bob?
All right. I've seen a lot more people wearing just face shields. Are they adequate protection for the wearer and the people they come into contact with?
We believe no. We would prefer you to wear your mask. Obviously, health professionals wear a mask and a face shield often when they're dealing with someone who's a known COVID patient. So we're not allowing face shields within Wyandotte County to take the place of a mask unless there is an explicit health reason signed off on by a physician.
Yep. And, certainly, I don't know if I've seen CDC guidance on this, but certainly the World Health Organization did come out with a statement saying face shields do not equate to adequate barrier protection. We do see the face shields that are like the welder masks that come down. When I was walking the other day, I did see like a half face shield that was coming up from the neck. That is absolutely not going to provide any barrier protection whatsoever. I would encourage the use of eye protection with goggles or a face shield, but you absolutely need to have the barrier protection with the mask on as well.
All right. I think we're going to do final thoughts. I'm going to start with Patrick, and I want to tell you thank you again for coming and sharing with us. What are your final thoughts and your call to action?
Well, thanks for having me again. I appreciate it. Appreciate you highlighting the work we're doing and what's going on in Wyandotte County. I think my final call to action would be people with any degree of symptoms, especially as we get towards cold and flu season, and maybe arguably already are at cold season, to get tested and find an opportunity to get a test. I say that because I mentioned the staff people we've had tested. We've had a couple that have said their symptoms felt like no more than a cold, and they didn't decide it was worth a test until they lost sense of taste and smell. And so I think even when COVID is in front of our face every single day, it's still easy to say, oh, this is allergies, or it's a cold, or something much smaller. So just another encouragement to people with any symptoms to try to get tested.
Thank you, Patrick. Juliann, thank you for being here. What are your final thoughts?
Absolutely. Something we didn't touch on today, but that I would really encourage is that if you do test positive, wherever you live, please answer the phone when your health department calls. Please do your best to gather that contact information for us. Please follow quarantine and isolation guidelines. Those things make a tremendous difference. We would also encourage people to go ahead and tell their employer when they test positive, because we are not allowed to call them and tell them that an employee tested positive. So, COVID is not an indictment on an individual or their behavior or their life. If you test positive, the best thing you can do is be transparent, tell the people around you that you've tested positive. The other two quick plugs I would make, which I'm sure you guys talk about frequently, please get your flu shot. And also, we mentioned plasma earlier, but blood drives are starting to happen a little bit more. We're having one in KCK at the end of October, so please participate in those if you're at all able to do so.
Well, send us the information, and we'll make sure to remind everyone.
Awesome.
All
Thank
right.
you.
Yeah.
Dr. Hawkinson, what's our call to action today?
Yeah, well, I mean, to echo what you said, it's not an indictment on anybody's lifestyle. There's no stigma about COVID-19. As Dr. Lisbon put it yesterday, just understand these concepts. The virus is out there, so the virus is ubiquitous. It's there. Understand that. That is the first one. With that, then you understand the other concepts. And this is where it takes strong leadership in the businesses and in the schools to say, these concepts are what's going to protect you, and that's distance. If you can distance as much as possible. I know in some of the schools it's a little bit more difficult. Some of the businesses it's a little more difficult just because of square footage. But distance, further distance is better, and mask wearing is important. Whether it's the servers or the clients, or whether it's the students or teachers, everybody should be wearing the mask in those situations. So taking it off in the classroom is not the best practice. It's not optimal. So if you can understand that the virus is out there, that if you distance, that's going to be better. If both parties are wearing a mask, that's going to be better. Those are the large concepts that you have to understand. And when you do that and you continue to do it day after day, it will become second nature and it will become a lot easier for you. And as Dr. Lisbon put, it'll be our new normal. And that's kind of what we're heading into for the foreseeable future.
All right. We appreciate everybody and your comments. Tomorrow, we are back in the studio. Amanda Gartner will be with us to help Dr. Hawkinson answer your questions. So send them now if you want, and we will start adding them to our growing list. And remember to mask up in honor of Dr. Stites, who may be gone from us this morning, but never forgotten. Tony sent this photo of his niece and writes, "We wear our Star Trek masks so I can teach her how to live long and prosper. She can almost do the hand sign." And we also had 2 of our Central Transport Department staffers wearing masks, and they said, "We know Dr. Stites would really especially love the Raiders mask." Well, maybe not.
Well, there's Shirlitha too.
Yeah. All right. All right. Thank you. Make sure that you keep sending us your masks photos. Pretty soon we're going to be asking you to send us some photos with Halloween and how you are incorporating those into your costumes should you decide to celebrate the holiday. Thanks again. Make it a great day. We'll see you tomorrow.